of BNYS from a fresher to till here. Only 4 years of experience. Still, I will like to share that because I think it will be valuable for all the upcoming students. The time when we come out of the college, the things which comes into our mind will be either I should go for the higher studies or I should go and practice clinical practice. I should go to into a clinical practice or should I go for research? So it is to me that I prefer to go for clinical because I don't want to write any more exams by uh, pursuing any higher studies. So I choose to be go for a clinical practice, and I think once we have a good amount of clinical experience, also we can start research by our own. That's what that was my view on complete after completing the BNYS. Um, so first itself, I think we should all be aware of the effectiveness of our own system. We should be aware of how effective the naturopathy and yoga. For that, we should aware of how it is going to affect us. The sense we should give complete belief in our system. Then only we can teach others or we can treat patients. That was my idea about that. So I prefer to go in clinical practice. So first place where I work, it was in Udupi, Karnataka. For 6 months, I worked there. So I share one only one case study which made me to believe in the naturopathy system completely. Till that, I was like a little bit of confused about is it going to affect is it beneficial for everyone or is it only going to benefit for those who want to just reduce their weight and obesity. So I was in a state of confusion because just complete the BNYS and start working after 3 4 months directly after that. um, then I came across a person. He came to our clinic. I was working as an RMO at that time, and I had two senior doctors. One is naturopathy, and another was Ayurveda. So there was two systems which was practicing in that hospital. So he came with the complaints of auditory hallucinations and insomnia since past 7 years. He have a past history of taking drugs and alcohol and everything, which must be the reason he spoiled his sleep and everything. And he was working in a very good, highly reputed company. But because of all these issues, all these health issues, he quit the job and he started to take medications. He started to meet doctors. He's from USA. So he went to meet doctors. They started prescribing medicines, and he took that for long years. His weight started to gain. His digestion. We should say that his complete lifestyle or complete life quality has been reduced after that. So since then, he started to research by himself to know what else he can do other than going for the modern medicine, other than going for these all treatments. And he came across Ayurveda, then naturopathy, and everything. And then he started to visit India. He came to India. He started to um search for a good Ayurveda hospitals, and he just before coming to our hospital, he was there in an Ayurveda retreat for 1 month. He did all the treatments and everything. He felt good after that. He felt he just getting detoxified. His symptoms start to reduce a bit. He started to reduce the medication score also. Then he want to try naturopathy also, and he was very should say he believed in naturopathy much more than of us at that time. He actually believed in naturopathy more than me at that time. And he came to our clinic. He started to take treatments for 20 days, naturopathy. It's mainly naturopathy treatments. And he preferred to be in raw food, mainly fruits and vegetables and juices and everything. He just consumed very little amount of cooked food because he was following Dr. Mose. He showed me the videos of Dr. Mose who follows who treat main different cases with raw food, with providing raw food, fruits, and everything into the diet and changing the others' life. So he was showing me all those videos, and I was also inspired with the way how the it was explained by Dr. Moose and everything. Then mm, after 15-20 days after that, he want to shift to Ayurveda because the doctors want him to go to Ayurveda and experience it. So they start to put him in Ayurveda, but in Ayurveda they have a specific diet. They have to follow cooked diet at these all intervals and everything. So he said he's not comfortable with that. He just want to continue in the raw only. Then he continued in the raw and he started to take few treatments in Ayurveda. Then few days after that, he started to get itching. He started to get rashes on his hands. At this point of time, he was actually reducing his medications for the insomnia. He has reduced his sleeping pills from 10 mg to 1 or 2 mg. At that period, he was breaking down every day. He was trying to breaking down. At one point, it came that he started to get rashes. Then the Ayurveda doctor consulted him. He said he stopped or he reduced the dosage of medicines already. Then the doctor said, "Oh, okay, then you have to continue the medicines. It must be the effect of uh, withdrawal. Due to the withdrawal, this might be the symptoms which you are experiencing." And she asked him to start taking the medications once again. Then what he replied was, I came here to reverse my condition, also to stop taking medications. And you want me to again go back to those medicines which I want to get rid of. So that just shocked her, and they were not able to say anything. Then he continued on his medications with a very small amount of dosage. Then this rashes start to increase. His hands, the skin of the hands start to scale off completely. Then at night, he started to experience severe headache. Severe headache means he cannot bear. He just want to uh, break his head. It was that much painful. He was not able to bear. So I was an RMO, so I need to attend there because I have to take the emergencies only. So 2 or 3 a.m. At the night, I just ran into his room. Uh, he don't want to take any medicines at all. He have cream, he have all the steroid cream and everything with him, but he don't want to take that. So at that point of time, I realized that my theory, what I learned from the college, was a bit confusing, or there was no one to guide me, or it must be my mistake also. I didn't take guidance from anyone, but it was fine for me. There was a plenty of aloe vera in that hospital. So what I did, I took the aloe vera, I took the aloe vera gel from that, I applied on his skin. He was fine. Then he started to again get the headache. Then I used to give a head massage, a kind of a stress node, a massage which will be removing the stress node from our neck, shoulders, and everything, which I um, learned, which I saw first in SDM when I was doing internship in SDM. So I start to apply those things. I start to give those massages throughout his hands and everything. Then his headache start to reduce. Then again his itching start to reappear. So I need to keep applying the aloe vera gel all the time. And once I apply, then he start to get the headache. So it continued for 30 to 40 minutes. Then he was able to sleep. So the time when he's reduced taking the sleeping pill, his sleep completely gone. That means he cannot sleep at all, not even for an hour. So after this massage and everything, he was fine. He just slept the whole day. He was able to sleep. Morning time he slept, and night he is not able to sleep. Then again, the same incident happened for next 5 days. So first day, it was only the itching and the rashes on the skin and the scaling of the skin. The second day, he was not able to eat anything. He was not able to even drink coconut water, tender coconut water. If he drink a full glass of tender coconut water, he vomit it out completely with a lot of mucus into it. So that's become a difficult thing. Um, the doctors, the senior doctors also ask him to continue taking the medicines and other uh, drugs which will help to subside the vomit. He said, no, I don't want to take those medicines. I don't want to take. Then his at that moment, I realized that his willpower, his belief in naturopathy was intense. Was it was much more than of any of us. So I don't need to convince him much about that because as we doctors, we are teachers. We should teach our patients to go through all these conditions called as healing crisis. So this was the first one I learned. The body heals itself if we left alone or if we give a chance for the body to heal. So this healing was happening there. And this to what he was going through was the healing crisis what we learned. Then so I don't need to convince him much about that. Only thing I want to take care of him because I was not knowing how to put this theoretical knowledge into practical perspective. Then I started to understand, okay, this is what actually happening is the time when we stop taking the medicines, the body is starting to push out these things from the body because there is a less overload on the system through the medicines. So now body got a chance to remove these toxic materials from the body. So the body start to remove it. Detoxification in a simple form we can say. So the body is trying to detoxify, our body is trying to remove those toxins through the skin because skin is one of the largest organ, also a largest eliminative organ we can say. And also the toxins, if those toxins has been removed through the kidneys or through the mucus or to other parts, it may damage the specific part. So the body have that intelligence or called as a cellular intelligence to know through which I need to throw these toxins out of the body. If the skin got damaged, it can regrow, it can even repair it. But if it's damaged, if these toxins go through the kidney and if it damages the kidney, it may be irreversible. So the body knows everything, how it has to manage, how it will push out, how it will be throwing out all the toxins from the body. Only thing we need to give a chance for the body. And he got that chance when he came there and he was following in a proper diet and a good treatments, we should say. He was not following everything. Only in the diet he was able to manage. He was not into the yoga part, not into mind and relaxation things and everything. So just with the diet, he was able to get that. So the time when he stopped taking the food, obviously his energy levels will fall down for few days. So his energy levels are very low for first 3 days. He was not able to eat anything. Even if he start to drink some amount of water, it start to get a vomiting sensation. So he need to drink water sip by sip. And if he vomit, it's a full of mucus what he was throwing out. So 5 days he didn't have anything. So it was a fasting which is triggered by his own body. His body realized that he don't want to eat anything. It's a good time. So the body was trying to heal because body got the chance to heal. So it continued for 4 to 5 days again. After that, I managed all the symptoms with the same thing, the aloe vera, the massage, the nodular massage or the stress nodal massage, everything. Then after 6 days, he was able to eat a bit. He was able to drink some amount of coconut water. He was fine, and his sleep was better. not completely fine. He was able to sleep for 2 3 hours without taking the medicine. He stopped taking medicines after that completely. He stopped taking after 5 6 days. He didn't take anything because whatever he take, it's all vomiting it out. So 5 6 days, he stopped all the medications. Mm, sleep was fine. Then again he continued for 20 more days. 20 more days in the hospital. So total he stayed around 40 days. So he only followed the raw diet into his diet, only the raw diet. But the time before he leaves, he just had a little amount of cooked diet, very light amount of cooked diet, not heavy rice or anything, a brown rice and everything he had. And he left from there. He was fine, almost he was fine. Then after 6 months, he texted me back that his sleep is fine now. Sleep is completely fine now. He was following 70 to 80 percentage of raw, and he don't have any kind of auditory hallucinations anymore. His energy levels become fine. The weight what he was gained during the last 7 years has been come down, and he was perfectly fine. Only thing he's little stressed about searching for a job. That's it. And he must have got job. After that, I didn't have any contact with him. So in with that case, I was completely convinced about the efficacy or the effectiveness of naturopathy system. The first principle what we learned in the first year, I experienced it personally after completing my BNYS. So it was fortunate for me that there was no one to guide me at that point of time because the senior doctors were more convinced about the other medicines than the naturopathy. So that principle I learned after him. So I am very thankful for him. And later on, I got a chance to work in Pragati Shakti Clinic of Natural Medicine. And since then, I am working in Pragati Shakti only. So fortunately, in Pragati Shakti, it is completely raw food what we are providing to the patients. Whoever comes, we provide complete raw food. Raw food, it doesn't mean that we just putting a salad and giving. No, the chefs are making a wonderful job over there. They're making different types of recipes, more than 200 types of recipes they have made, with the soups, the gazpachos and everything. So it was much more easy for me to understand the efficacy of also the raw food rather than the cooked food, because with the raw food, his recovery was much more than that of the cooked food. So I guess the raw food and the once we include raw food into our diet, it will be much more easy for the body to accept it. And once I came to Pravi Shakti, it was much more easy. And I was also convinced, even I was able to explain this incident to other patients, which helps to convince the others also. Then I start to learn more about the raw food, how it is going to help and everything. Then I start to learn the other principles of naturopathy, the detoxification process, the toxemia, and everything. And yeah, that's it. That was my experience. And I would say everyone, the freshers who are going to about to come out and everything, if you get a good mentor to work with, a good guide, a good senior doctor to work with, it will be a very helpful for you. So first, I will say, don't directly jump into. This is according to my idea, my way of view. That don't just directly go for a six-digit salary or anything. First, just put yourself into study, because we studied the theory. We don't have much amount of practical knowledge, so others must be having. But I am telling about myself, I didn't have much. It was my uh, bad luck, or it was my issue only. I didn't dedicate much into it because I was not completely believed in the system. It everything happened after try completing the naturopathy. So first 1 or 2 year dedicate yourself completely to learn or completely to pursue or completely to understand what it is actually happening instead of going for making good amount of salary. So just like you doing and pursuing in higher studies with less amount of salary, we can say, and getting good amount of experience because that experience will help you to grow later on. That will help you to gain good amount of money and knowledge later on. So first 3 years minimum, minimum 2 years, you can try to improvise yourself, try to learn many things as much as possible. That will help you a lot in your upcoming years, I would say. And yeah, that's it. Do you have any questions, any doubts?
Yes, if anyone is having any doubts or queries, you can unmute or ask, or you can write in text chat box also. So it was a very short session, but it was very good. So if any doubts are there, please do ask. There is a question in the chat box.
Okay.
So
And how did you come across any cancer patients and how do you treat them? Uh, um, no, I haven't come across any cancer. It was a post chemo cancer I got. We saw in Pragri Shakti. Um, so what actually happened in the post chemo? We all know that the hair loss, the weight gain, the lack of energy, lack of hope, the mood swings, everything. So I guess they stayed for 14 days in that. Um, for them, it was main thing will be convincing them because cancer patients they have a kind of a fear. A fear. I guess that they have a fear of it's done. I'm done. I'm going to die anyway. There's nothing can help. So that's a fear they have. So once we able to clear that fear by all the counseling, all the meditations, yoga, pranayamas, and everything, and whatever we do later on, if we remove the fear and if we start to introduce everything else, they will be fine. And it was a lady, she till 10 12 days she was not completely convinced with the treatments, she was not convinced with the diet and everything. But later on at the time she about to leave, she realized the changes because she was only they were only point out, okay, still these symptoms are there, still I'm not able to completely come out of it. But they haven't noticed the small changes what happened in their life after that. Small changes happened in their body after the experience the naturopathy or the self healing. So only thing what we are able to give is the nourishing the body with all the nutrients, because that's what mainly the raw food is going to do. The nutrients which your body is lacking from taking the cooked diet. There are many nutrients which will be unavailable or which will be destroyed when we cook. So these all nutrients or micronutrients we can say, these all nutrients will be provided more into the diet through the raw diet. So once we give that, the healing or the quality of life will improve. So after 14 days, they were almost kind of okay. They are ready to do that, and she was able to. She said, okay, she will start continue taking the diet at home, and she will get back to us. So it takes time. It's not a magic what we are going to do. It's only we are making them to realize to what your body is trying to say. That's what we naturopath has to do. The natural heals. The physician just take care of the patients. That's what I believe. So we just need to convince them. We just need to make them to understand that this is how you have to go through it. And if you able to follow this raw diet and change, try to feel the changes, then you will be able to uh, continue it. If you feel beneficial after continuing the raw diet or having a lifestyle like this, if you feel better, try to continue it. Then you will be able to feel the changes. So it's all take time. We will do if patients can tolerate healing crisis. Okay, what we will do if patients can tolerate healing crisis? So we cannot actually. I believe that we cannot actually distinguish from the healing crisis and the disease crisis. It's all we have to understand and from that person's energy and how they are reacting to us, their pulse, their vitals, their energy level, their bowel movements, everything we need to check. And if you feel that the patient is not able to tolerate that, then we need to suppress those things in any case. Otherwise, only thing they need to bear it. If they have the will to bear it, they will be able to go through that. If not, we need to keep convincing them. So what in Pragya Shakti we will be doing is we have a conservative diet, Sutrian diet, and the eliminative diet. Once they go to eliminative diet, they start to get all this kind of healing craze in the form of headache, uh, loose motions, abdominal pain, body pain, and everything. So what once they get that, we shift them to Sutrian diet for a few days. Again, once they are ready, once they feel that they are ready to go to eliminative diet, we will put them into the eliminative diet. So we just do it in an alternative form, like eliminative diet for a few days, then shifting into soothing, then again eliminative, again soothing. So that will ease their conditions. I think I answered your questions. Now, raw food for long will not cause body to be deficient and digestion impaired. As I am still student, but saw one patient in clinic who went on long-term raw food diet, and then when breaking it, he or she couldn't digest any cooked food in later life. Yeah, that's true. So we don't believe that everything is perfect. There's nothing perfect in this field. So only thing is when you come for a healing, when you come for a healing purpose, I think the diet, everything that we provide should be beneficial, or it should be promoting the healing. If we take good amount of raw food, good amount of exercise, and if we stay in a polluted atmosphere, and if we ask them to heal, if we expect them to heal completely with a polluted air, water, and everything, no, it's not going to happen completely. The amount of healing will be less. So when we provide a proper atmosphere for the body to heal, so the diet will be playing a major part, because the raw diet will be much more like promoting the healing. It contains less amount of external toxins, we could say. There are intrinsic toxins, also the extrinsic toxin. The metabolic waste we can call as the intrinsic toxins, or the toxins which are produced in the body. The time when we take more amount of cooked food, it's a kind of it's more about we are fried. The oil what we are used is not that so good, and many of the nutrients get lost when we cook. So compared to that, when we take raw food, it will be much more easy. Not easy, it will be friendly for the body to digest. It should not be easy to digest, it should be friendly for the body to digest. So the raw diet, we can say it as a healing diet. Also, it is friendly for the body to uh, digest it. And impaired. Okay, yeah. So we only want to make them to understand that it is a healing diet. If you able to take this food back to home, if you're able to include some amount of fruits and vegetables into your diet, we are not saying you to continue completely on raw diet, but if you're able to include some amount of raw diet into your daily routine, it will be helpful for you. It will stop, or it will prevent the progression of disease, and it slowly start to reverse. So it's again according to their period. If they want to increase their raw food, and that healing will be much more faster. And so patient clinic who went a long time for the okay. So what we do in Pragya Shakti is before they leave from Pragya Shakti, first 1 or 2 days back itself, we will start to provide them little amount of cooked food. Cooked food, it doesn't mean that it's beaten everything. It's uh, bajra rotis and other things will be made, and other Kerala style recipes which is having very less amount of toxic load to the body, which is much more organic, we can say. So that once they go back, and once they go back into the flight, and they will be able to eat it easily. So we cannot completely leave them in the raw food after finishing the treatments. It's better to go for the little amount of cooked diet, so that the body will be get adapted to that slowly. Otherwise, it's they are going to vomit it out completely because of indigestion. So yeah, so I prefer to be we prefer actually to be balanced between the cooked and raw food diet, not completely into a raw diet. It's again up to their priority. So what's your opinion about raw food and role of ulcerative colitis patients? Okay, clear, sir, thank you. Okay, about raw food and role of ulcerative colitis patients. So in ulcerative colitis patients, we cannot, we haven't given the raw food directly or the first day itself, because the fiber in it will again trigger a kind of irritation in the colon. So we provide very less spicy, very less cooked diet, which is much more alkaline nature. That is, it's not very highly boiled or fried. So a small half-boiled diet or cooked diet we can give for first few days. Later on, the symptoms everything start to reduce it. Then we will be able to give the raw food. It will be much more like smoothies and everything in a interval, in a specific interval. Instead of going forward to 1 or 2 or 3 meals, it will be like 3 or 4 meals, but in a very less amount we'll be giving it. And for ulcerative also it is it will take time, because they need to keep continuing at their home. Then only will be able to and get a proper result. But they were able to get a result within 7 days. Like, they felt better actually after continuing that. um, to reduce eye power with diet. I heard that with 2 months of raw food diet we can how to reduce eye power or how to increase eye power. It's I heard 2 months of raw food diet we can reduce our eye power with eye exercise. Um, I think Kaushik syndrome. I think it's to increase eye power. Uh, Regarding eye power, we haven't come across any cases so far, but raw food will be really helpful for that, because vitamin D, the beta carotene, everything will be is 7. Mm, so a proper diet, a proper the raw diet will be much more. It will be helpful. It will be helpful. Also, the exercise is also important. But there is a one study. I guess it's minimum we need to practice for 6 months or something. Then we will be able to get a change. Uh, yeah, I don't know the exact name of that research study, but with the exercise is important. Also, a proper diet, the raw diet you can include into that. That will help. That may help, we should say. And again, regarding the eyes, it will be we should know what it is actually, what the cause it is actually. But like, is that lens or the muscles which is weak, or it's due to the pressure on your cornea, which is making your eyes less powerful. So for that, it's better to go for a proper diagnosis. Then later on, if it is due to a kind of a manufacturing or a genetic problem, then it will be quite difficult. But if it's due to a lifestyle, by looking into computer or mobiles and everything, then there are chances of getting it little better, I guess.
Okay, so I think the questions are completed and you have answered everything from start to end. It was very good. I thought it
Okay,
was
I guess
learning
so.
for me also and for all the participants who were there in this
Okay,
session.
thank you.
And thank you so much to come on this platform and share the basic first principle of our naturopathies to whom we will start our journey of BNYs. Body heals
Yep.
itself.
Yes,
But
heals
we do
itself.
not have the chance to follow, to see that experience. But you are the fortunate, and your experience is very much useful for us to follow the system of naturopathy. And I hope everyone should follow if you are there in this system of naturopathy. So thank you so much to come on this platform. Thank you so much. Thank you
Okay,
so much.
thank you, Bhavit, for giving me an opportunity to talk in your platform. Thank you.
Thank you, everyone. Namaste.
Thank you.
Take care. Bye bye.